Hi everybody, this is Aisha and Dean, and thank you so much for joining us on one of our latest episodes. So today we have an interesting topic to talk about.
Yes.
We're going to talk about medication and lifestyle and the relationship between the two and where we should move in the future.
Yeah, this is the foundation of healthcare of the future. We keep talking about precision medicine and the future of medicine. Where we need to go next is a better understanding of proper use of medicine, and from there how to interrelate it to lifestyle. Right now, how we're using medicine is incredibly poor, incredibly blunt, and it has significant healthcare consequences. In fact, it's the third leading cause of mortality in America.
Absolutely.
The healthcare system that we are part of is contributing to death of patients by the thousands, if not tens of thousands of people. Leading cause.
That's about 700 people a day.
That's remarkable. And that's because of mismanagement of medicine. I know the title was a little inflammatory and to get your attention. It's not versus. We are not against medicine. Medicine's amazing. Medicine's been amazing for us. It's why we are living to age 80. We gave a talk yesterday to a large community, and I over there I said the fact that there's some statistical model that shows that more than 70% of all the people that have ever been alive past the age of 65 are alive now.
Yeah.
We're living longer. Why? Because of medicine and medications and procedures. Those are fantastic. Mm-hmm. Again, we say that that's sick care. It's important, but that's sick care. But it's not the totality of healthcare. Healthcare that's being avoided, that's being neglected, and there's almost like a passive-aggressive relationship between doctors and hospital systems and prevention. The part that's missing is prevention, true prevention, not just giving the few words here and there, and but prevention is absolutely lacking. That's what we want to, not just this talk, but a series of talks about what prevention means, and prevention and healthcare is in your homes, and it's in your communities. And that's why we go to the communities. Mm-hmm. That's why everything we do, even the funds from the books, the profits, all of it go back to the communities. Because if we don't meet the disease at that stage, by the time the patient comes to the emergency room, 50% of the battle is lost. That's why this is so critical that we start this conversation. A new approach to medicine, a proper approach, and not so myopic of an approach where every specialty gives their medicine without any knowledge of its effect on other aspects of the body. So that's where we want to start today.
Wonderful way of presenting it. Let's go into some details because I think these are critical numbers for all of us to understand. And this comes from reports from CDC and validated sources. Roughly half to more than 2/3 of Americans are on medication, at least one prescription. And more than 1 in 5 American actually takes 3 or more prescription. And as we age, of course, the numbers will grow.
And we've seen patients in our population, stroke and Alzheimer's and others, that have come to us with 15 to 30 medicines.
Oh,
actually, I've seen people with buckets.
Yeah. We there's a joke in the clinic when we see somebody coming into the clinic on a regular basis and they come with shopping bags and like, oh Lord, here we go again.
Yeah.
We actually have to sit down and go over all of these medication, and it's becoming the norm.
And then on top of that, you add the nutraceuticals, which are not checked by FDA, by anybody. And that adds to the complexity because they're not benign. We keep using words as if they have meaning, but they don't have meaning. Natural, that's a more common one, the most common one. It's natural. Well, everything is natural, but have we tested it for its effect on your body? A very bad joke that I give. I have lots of bad jokes, but this is one that is that lightning is natural, but I don't want to get hit by it.
That's true.
Same thing with foods, sugars. Same thing with certain nutraceuticals that have active agents as much as 3 times what body can tolerate, yet because they're not regulated, we take it and then we mix it with other medicines.
Absolutely.
And they interact in the body.
Oh, it's a dangerous cocktail, and there are a lot of people who end up in the emergency because of polypharmacy or multiple medications given together. And there are different reasons why this actually happens. One of the main reasons, especially in the elderly population that we deal with, is a lot of elderly have different doctors. They have multiple providers. They get their pain medication from one, blood pressure medication from another, diabetes medication from the third one, and there's very little communication between these physicians.
Not at all.
And so, they end up having 13 to 20 medication on board, and they have a lot of interaction, and a lot of them end up in the emergency room.
And in fact, there's always interaction and side effect. The side effect might not get to the point where you recognize it, but it might actually end up chronically. So that's why it's so important to actually have a quarterback, a general practitioner that actually has the time to actually go over this.
And stay tuned, because at the end we actually have specific points of what you need to do to avoid polypharmacy, to avoid being on multiple medications.
By the way,
we'll discuss all of that.
I was just kicked under the table because I was about to give away something really good from the end. So keep up with us.
We have a small table.
Yeah, but nonetheless, it is important. So
No, one of the other things that I just thought about is, it's not only an adult issue, a problem in the adult population. A lot of kids, are on a lot of psychotropic medications specifically, whether it's ADHD to depression, and kids that start at a very early age are also on medication. And according to a CDC report, 1 in 5 children taking psychotropic medication, which is for ADHD and depression, is on a combination of pharmaceuticals. So, to have those strong medication on board for children is devastating, can be devastating, and can result in really critical situations. So, being aware that medication can be very dangerous and that hospital and medical errors happen on a regular basis kind of empowers us to make sure that we understand what we need to do at home and in the communities to be able to stave off such medical errors.
I'm going to say this several times. The point of this is not to disempower you, to make you feel hopeless and helpless. No, we'll give some recommendations as far as how you can get control of this. Every time you take a pill and then you add another pill, there's a chemical reaction in your body taking place that was not intended to take place.
Yeah.
So we have to be aware of that. And then when you have 5, 6, those chemical reactions will have significant consequences.
And one of the other issues, which is very important for us, is that for a majority of diseases, especially for chronic diseases of aging, we've become almost very desensitized to lifestyle changes as physicians. A lot of physicians don't spend a lot of time talking to individuals about prevention of their disease, like you said. It's almost, most of our desires to be on medication is driven by whether it's advertisement or hearing it from other family members and friends, and it's almost like patients actually demand medication when they go to the clinic from their doctors, and so lifestyle is usually not talked about.
It's not that the medical community doesn't recognize it. It's not that they don't recognize the importance of it. We see an immense amount of public health information and research. It's that doctors are never trained. In one of our previous blogs, we were arguing, and somebody came back arguing with us, saying that, oh no, this other point of opinion comes from a doctor. Well, that doesn't give it any greater credence. Medical professionals are almost never trained in prevention.
Absolutely.
And as such, it makes it more dangerous, because now you're given the responsibility to take care of people after 16 years of education, where you've got no training in prevention and care outside of the clinic, and you feel the sense of responsibility and you don't know it, so the only defense you have as a person is to be incredulous, to push it away. Because if you don't know it and you're responsible for it, I go back to what I know. Mm-hmm. To a hammer, everything is a nail. So it's important to know that. So it's important from the policy perspective, from the medical school perspective, from the community health perspective, to hold doctors accountable to get training on nutrition and lifestyle, so that all this noise that we hear from keto, from this and that, which actually should be easily quashed because there's no data, because the doctors are not actually fighting back or pushing back. They don't have the data. So coming back to polypharmacy and medication and proper use of medication, and its interaction with lifestyle is where we are today.
Yeah, absolutely. So, we all, as physicians, we have some stories where, medication go unnoticed and people are on all these dangerous combination of medication. How many times have we actually seen patients coming in with dual antiplatelet therapy? I deal with a lot of stroke patients, and I can't tell you how many times people come in to the clinic and they're on an aspirin and another blood thinner, clopidogrel, or an additional one as well for stroke prevention, and they have all of these risk factors, and nobody really took the time to tell them that there are lifestyle measures that they can take that could significantly reduce the risk of stroke as well, and they end up having the side effects of being on these blood thinners. I had a patient who was on this dual antiplatelet therapy, and he was bruising, and he kept on calling his primary care physician to let them know that this is something serious. I'm bruising my arms, legs, and he ended up hitting his head. He slipped and he fell and he hit his head and he started bleeding in his brain, and he was in the ICU for weeks.
Yes. I had a patient who recently had a death in the family within a couple of months, and went to a doctor, and the doctor immediately put them on antidepressant, and she wasn't even this, it was just functional sadness, depression that could, there could have been some conversations, some support, high doses of SSRIs, these antidepressants. This person started having muscle cramps, having sleep disorders. And not that everybody will develop that, but that's one of the side effects that you will see. And she started having significant sleep problems. Of course, what happens next is they added sleep medication and high dose of sleep medications. And then sleep medications actually completely made her almost like a zombie. She was disoriented. She had difficulty concentrating. So you went from a functional sadness all the way to the point where she became disoriented. And of course, she also fell and broke her hip. And all this started because the sequence was not followed by the doctors, that you didn't have to start the medicine in the first place. Mm-hmm. And then if you did, you make sure that you start, what we say is, if you have to start a medicine, start low and go slow when you can. So that's why it's critical that you are in charge. You do your research. Again, I'll leave that for the end. Yeah.
No, great points. I think we should talk about, what are some of the steps that patients can do and
Absolutely.
take ownership of to prevent, potentially devastating outcomes. And one of the most important things that we can do is to ask questions, as many as we can, and to understand that when a medication is started, it comes with a lot of side effects, and to better identify those side effects and be careful and let your loved ones know in the family to look out for things, because sometimes people can't be aware of whether they're going through those side effects or not. It's very important.
It's important to go to the right sites. So you want to go, whenever somebody tells you that they're going to start you on a medicine, first of all, if it's not urgent, give yourself some time. Do the research. Go to a proper website. Check the side effects. Print it out. And then your other medicines, and print those side effects out. Then the next thing to do is, there are other sites that looks at drug-drug interaction. Yes. And if you don't have access to the site, or you can't interpret it well, go to your pharmacist and get that. Write it down. And then this piece of information is pivotal.
Absolutely.
We as doctors, we all say, "Oh, here comes the Google doc," or we're not saying go to Google and search for anything, because you will find anything. But there are proper sites that you can go to that can give you information that can be used, and the doctors can't negate that.
And also your pharmacist is quite capable of providing that information for you. We absolutely love it when patients actually know exactly the names of their medication and their dosages, and are aware of what they take and how much they take. And writing it down, having a notebook, being organized helps quite a bit.
Absolutely.
And the other thing is getting your medication reviewed regularly, which means, you can't be on a medication forever without your doctor ever checking it.
Although you're made to believe that that's the case. How many of you have had your doctor tell you that you're being placed on blood pressure medication, and there's a time limit to this, or there's a time period to this? Because in order to get off the blood pressure medication, you have to do things in your life that actually reverses the underlying cause. Let me give you an example as far as blood pressure. One of the big ones that we always talk about. You're on blood pressure medicine because either your arteries are clogging up or they're stiffening up. Same mechanism, or inflammation and cholesterol buildup and damage. Now you're given an antihypertensive medication. Mm-hmm. This medication either makes the volume less, so you urinate, so get rid, or it actually loosens the muscles of the walls of the vessel
to make it more pliable.
But it has done nothing to address the underlying cause. Why is the plaque building up? Why are the walls of the vessel stiffening up? Nothing as far as that. So a few years go by, or a year actually, and then a second medicine is added because one is not enough. And then after a few years, the third. By then it's too late. By then you can't do anything to reverse the process. So the relationship we were trying to build is awareness of the medicine. First of all, if you need to start it, if there's an urgency. If you're going to start it, it has to be a timeline to it and a plan of how to address the underlying problem if the underlying problem can be addressed. We're not saying every medical problem can be addressed through lifestyle. Absolutely not.
Yeah, absolutely. And this applies for all the blood pressure medications, for statins especially, for cholesterol medicine. In stroke neurology, when somebody has a stroke, we put them on a very high dose of cholesterol medicine initially. Sometimes, it's for a combination of reasons, to lower cholesterol, but also to lower inflammation, because some
which is useful, extremely important.
Very important. It significantly reduces the risk of other strokes in the future. However, it doesn't mean that one has to be on it forever. So getting it checked on a regular basis and having those conversations every 2 to 3 months with a physician is important, and also getting your blood checked to see whether it has affected your cholesterol levels.
And they have side effects that have been either purported or are being investigated in other studies. Cholesterol medication has this side effect is well known. For a large proportion of population, they have muscle pain, joint pain, difficulty with memory sometimes, especially short-term memory. There's question whether it has effect on long-term memory. So initially, if you had a stroke, if you had high cholesterol levels that are of urgent levels, high enough to worry people, absolutely, they should be started. But the plan should be there to reverse the high cholesterol through lifestyle. Otherwise, you're stuck with the drug that's not without potential long-term side effects.
Agreed.
So it has to be addressed. Oh, another side effect of cholesterol-lowering medicine: sleep problems.
Oh, yes.
Yes.
Absolutely.
So that's why it's critical that we start having that approach with medicines and relationship with lifestyle.
And also speaking with your pharmacist or with your physician or your pharmacist about combination pills. Nowadays, there are medications that are combined that addresses, 2 different types of conditions at the same time. For example, for heart and blood pressure, for diabetes, there are different combination of medication, and that significantly reduces the number of pills that you're on. So there's so many other different ways to do this, but I think the most important thing is just awareness, being aware of what goes into your body. Absolutely. And knowing that they have side effects. And of course, none of these changes should be made without consulting your doctor and your pharmacist.
Absolutely.
Because there are a lot of medication that could potentially, significantly increase the risk of mortality if there are changes made drastically to it. So talk to your doctor first.
Correct.
And let's go ahead and answer a couple of questions. We actually got some questions earlier as well. There's no money in prevention. Well, that's true. I think the healthcare system is not really reimbursing prevention as much as it should, but we see a slow and gradual change in that way. There are a lot of people, a lot of physicians who are getting more educated as far as lifestyle is concerned, and they're combining the importance of lifestyle and prevention along with chronic care.
But there's a little noise there, because at the same time that that's happening, other doctors are picking up on the gimmick of the day, the diet of the day, the vitamin of the day. So you have to be able to distill that. Who is actually truly invested to proven century-long proven lifestyle factors, and others who are using gimmicks to reap rewards, financial rewards.
Judy says, any thoughts on pantoprazole? I would love to get off of this medication. Oh, Judy, pantoprazole. So that's a medicine that people use for heartburn and GI issues. I can't tell you, Judy, how many times we have had issues with doctors putting our patients on acid reflux medication, and there's been a few series that have actually shown that people who take acid reflux medication for a very long time, they actually tend to have nutritional imbalance, and it increases their risk of cognitive impairment.
Yes, there were some studies recently that showed that people who are proton pump inhibitors and other GI drugs have, over a long time, have a higher risk of developing Alzheimer's and dementia. That has to be further worked out, but there's strong enough evidence for us to worry, or at least not put people ad hoc without any concern, without any thought. So that's an important drug to think about.
Yeah.
And there are always ways to go around medications. There are other medicines that can take the place if there's an urgent need for a certain medicine, especially for GI. There are others that can take its place. And there are natural ways, if it's not severe enough, again, we're not the binary type all or none kind of thing. Mm-hmm. If it's not severe enough, natural remedies, and I don't mean unusual things.
Yeah, no
things
herbs
that have
or
been
anything.
Yeah.
But just changing your diet actually makes
Yes.
a big difference too. Staying away from certain things that increases gastric acid production, like a lot of fat and a lot of animal protein does. But if you eat a whole food plant-based diet, if you eat lots of fiber, that actually reduces the production of acid. Your stomach doesn't have to work hard enough to dissolve or to absorb all that fat and protein in it.
One story that just shocked me this last week was migraine. So I thought that somebody who's lived with migraine all their life, they might have actually, learned some of the basic stuff. But there's so much noise there that the people don't get to know even the basic stuff. So migraine is one of those maladies that really responds to diet, or is affected by diet significantly. Mm-hmm. There are major triggers for diet and lifestyle for migraine. Sleeplessness, stress, we've known that. But things like chocolate for some, red wine, cheeses, old aged cheeses.
Cured foods like processed meats,
foods with high salt levels. And there are others as well. These foods are major triggers. For me, it's cheese.
Yeah.
So and this person had no idea, after 20-something years of migraines, had no idea about these things, and was put on drug after drug after drug, to the point where she was on high doses of some really what's called vasoactive drugs. These are not benign. If you need them, you have to take them. But realize that they also have consequences at times. Well, we changed her diet a little. That's after 1 week.
Yeah.
Or that might have been a little bit of placebo. We'll see longer term. But she actually contacted me and said that her headaches were better.
Yeah.
I mean, that's remarkable. So a lot of your diseases that you have or you suffer from, be it migraine or GI complaints, see what has been proven in well-known, well-researched websites as far as what lifestyle factors could affect them adversely or positively. Mm-hmm. And there's a lot of data on many of these diseases.
Absolutely.
Including GI, especially GI actually.
Absolutely. So that's basically it. I think let's wrap it up for today.
Now you're going to give them the magical summary?
No, we just did. We went over everything.
Sorry.
Be aware, write down the name of your medication and take it with you at every appointment.
The side effects, research it from a well-documented, good website.
Exactly.
And the interaction, drug-drug interactions.
Exactly. Review your medication regularly with your physician. Make sure that you're not on a medicine for a very long time, and for your doctor to check your blood levels of whether it's cholesterol, whatever it may be that you're taking the medication for on a regular basis. Try to talk to your pharmacist on a regular basis again to find out whether your medications are up to date or not. Team up your doctors. If you are going to multiple doctors, make sure they're communicating well. One of the most difficult things for us is to understand the perspective of the other physician of why that particular physician placed our patient on so many medicines.
The two of us don't have that problem because we usually are sitting across the table. And she has no problem giving me her perspective. So, no.
We're blessed to be in the same institution.
Yes.
And that's basically it. Of course, the most important thing is don't make any changes without talking to your physician and pharmacist first.
And start instituting lifestyle changes now.
Most importantly.
Yeah, that will affect not just the current symptoms or disease that you suffer from, but long term significantly delays the onset of those diseases and quality of your life. So lifestyle should be one of your major medical interventions.
Absolutely. And with that, we thank you so much for joining
Thank
us.
you.
I hope you guys have a wonderful weekend. Again, if you have any particular questions, please post them in the comment section. If I didn't get to anyone, I'm sorry, but I'll try my best to answer all of your questions.
And follow us on
teamsharezai.com, on our social media, on YouTube, Facebook, Twitter, and Instagram, and let me know what you think of the new recipes on our social media. Until then,
Thank you.
have a great night.
Bye.